Hi, I'm Dr. Shaffir, Kassim from KMC Hospital from the Department of Medicine. Today, I'll be sharing some information regarding the new disease which is in town, which is called as Mucormycosis, which is very rampantly seen or been reported in COVID-19 positive patients. What is mucormycosis? There has been different names given to it, called as black fungus or fungal infection and all those things. So it is actually a fungal infection which is present in the environment. It is usually caused due to the inhalation of we call as molds. You would have noticed when there are wooden or the walls, when it gets damped or it becomes moist, there are this fungus which are released actually. So it is not a new disease. It has been there in this world for almost 130 years. In 1876 was the first mucormycosis case detected. As it was not an pandemic or an rampant infection, it was not monitored, but it is usually seen in certain set of people. So if you ask, how do you get mucormycosis or the infection mucormycosis? It is usually, as I said, through the fungus spores which is in the environment, which is already being hanging around in the environment. So it is usually let out by dampened walls, wooden furnitures, and it's very commonly seen in construction sites. If people are working in construction site where there are a lot of dust production, especially mixed with water, and also in disaster hit areas where you would have had a flood or a cyclonic attack, where there are a lot of materials or where there are a lot of objects which is there in the water which is damped because of that. How does a person get mucormycosis even if the mold has gone inside into their body? Our body immunity is quite strong, quite good enough. So even if the mucormycosis molds or spores have gone inside the body, usually the body's immunity usually fights it. You will not get the infection. This is a disease which is usually seen in a person whose immunity is on the lower side, or it is brought down, maybe because of medications, maybe it could be because of infections, or maybe because of any other particular disease it can have. So that's why we don't see mucormycosis in the normal situation around the world. It is quite less. In the normal population also, you don't see mucormycosis, even though mucormycosis or the fungal spores are rampantly available or is there in the environment around us. Next question which all can have, this mucormycosis, where and all it can affect in a person or in a patient. The places which it can affect is, one is the sinus. It can affect in the brain, it can have an infection in the lung, and it can have infection in the skin as well as in the abdomen. So coming into the symptoms, or what are the signs you can have or symptoms you can have when you have been infected with mucormycosis. If it is in the sinus and brain, you can have severe facial swelling, you can have nasal and sinus congestion, black lesions are seen over the nasal bridge and the upper side of the mouth. And if it's lung, it's like any other infection or pneumonia. That is, you can have shortness of breath, fever can be there, cough can be there, chest pain can be there. And if it's on skin, you can have ulcers. If it is abdomen, you can have bleeding, vomiting, nausea sensation, pain of abdomen also can be there. Next, most important question would be, who all are at risk of developing mucormycosis? Is it only for COVID-19 patient that we are seeing mucormycosis? No. Mucormycosis is usually seen in people who are diabetic with uncontrolled diabetes and have complications of diabetes. Patients who have undergone a renal transplant or stem cell transplant, or there's low white blood counts, and patients who are on long-term steroid usage, as well as patients who's got iron overload in the body. So these are patients. So if you look at this set of risk factors, everything is connected to one factor, that is the immunosuppression. That is your body's immunity power, where it fights back any particular disease. It is not only for fungus, be it any infection in the body. Always the body has a mechanism to fight infections, which is initially activated when any bacteria, virus or a fungus enters into the body. So here what happens is our immunity is going down because of, maybe when you have an organ transplant, you tend to take immunosuppressants which bring down body's immunity so that it doesn't fight with the transplanted organ. So similar way, if you look into it, these are the few reasons, because when high diabetes or uncontrolled diabetes also can bring down your immunity of the body. You can have multiple infections in the body. So these are few factors. So the main factor behind which you get a mucormycosis or mucormycosis infection is mainly due to the immunity being low in the body.